Dr. Akshay, I really can't forget that elderly lady who came to us for a follow-up last week. So she was suffering with such a severe back pain. And she was so grateful when she came to OPD with walking.
Correct. Yes, Dr. Deepak. I also remember that she had come just last week for follow-up also. She was actually a very special case. So she was actually diagnosed to have a very severe spinal compression. And poor lady, she was suffering with this kind of pain for many, many years. She had tried everything. She had tried conservative treatment. She had tried physiotherapy, exercises. She's even tried bed rest. She was diagnosed elsewhere actually by having this kind of severe compression, and she was really suffering with back pain. She could not even do her daily activities. She was having back pain which was coming to the legs. She hardly could walk. With great difficulty she was standing. She was even walking with a stooped posture, and when she came she was in bad shape. The thing is, she was advised surgery, and they were really afraid of doing the surgery because of the fear mongering among the people, where they used to think that spine surgery is not safe. If you do spine surgery you will get bedridden and things like that.
And I remember how we counseled them patiently about explaining the benefits of minimal invasive access surgery, where blood loss is very less, recovery is very fast, and she can get up and walk the same day after surgery, and we can discharge the next day of the surgery.
Correct, and that's exactly what we did. So she underwent that surgery after we had explained the advantages and benefits of this minimal invasive spine surgery. I think they were convinced in the end, and they realized that it's better to get up and be back to normal life rather than be having this kind of a disability. So she underwent the surgery, minimal invasive surgery, with a very small cut, hardly about 1 centimeter cut, and very minimal blood loss. The next day after surgery, she was able to get up and walk. She was able to do her daily activities. She was so happy. And now 1 month later, she has come back for a follow-up. She has come walking.
Unfortunately, many people still suffer the pain, and they are severely disabled, believing the spine myths that after spine surgery they will be severely disabled or they become bedridden.
Correct, and that's exactly where the role of minimal invasive surgery comes. Nowadays, with the advanced technology as well as advancement in techniques, we have advanced technology like intraoperative neuro navigation, intraoperative neuro monitoring. We have microscope, advanced endoscopes, wherein we are able to do these kind of surgeries with higher accuracy, extreme precision, and improved patient outcomes. They can get up and walk immediately after the next day after surgery. They can start doing their daily activities, and the most important thing is they get back to normal life after surgery. But Dr. Deepak, another interesting thing that I'm seeing nowadays is that it's not just the elderly people who are having this kind of spinal problems. More and more younger people are also coming, and with this kind of spine problems. What do you think?
Yeah, that's what. So in our regular OPDs, so nowadays we see the younger population, because of the longer sitting hours, lack of physical activity, because of the poor posture. So then, when they combined with sudden physical activity or some lifestyle activity, pain will suddenly get triggered in the back.
Correct, yeah. So remember another young guy who had come from the IT guy. Basically, he was diagnosed with this kind of a slip disc, and he even had sciatica, and he had tried conservative treatment. He was almost normal, but then after that he, I think, lifted some heavy weights in the gym, and he came back again. He was rushed to the emergency department, and he was in severe pain. He was having back pain. Everything had gotten worse. You remember that, right?
Yeah. So that's what, then we had to counsel him. We had to tell him about all the safe aspects of the spine surgery, where endoscopy surgery is less than 1 centimeter, less of blood loss, recovery is very fast. He can walk 4 hours after the surgery, and ultimately we discharged him the next day. So he was very happy with the overall recovery.
So that's what I think is very important for people to realize, that while surgery is never the first option, surgery is usually the last resort. And yes, in most of the cases we try physiotherapy, we try conservative treatment, medicines, exercises, and sometimes very rarely even percutaneous procedures like nerve blocks can be given to relieve pain and get back to normal life. But what people should not forget is that we should not neglect the symptoms, especially back pain which is coming to the leg, or chronic pain which is not subsiding with this kind of conservative treatment for more than 4 to 6 weeks. These are the kind of symptoms or red flags which people should not ignore. and those kind of times they should definitely get it addressed by a spine specialist. And at this time, sometimes when surgery is necessary, what people should be aware is that minimal invasive techniques such as endoscopic techniques, minimal invasive tubular techniques are there, which can definitely address the spinal problems at a very, very advanced level, and patients can get back to normal life with minimal complications.
And Dr. Akshay, I also want to emphasize that not all back pain or spine issues needs surgical treatment. So majority of the spine cases can be managed with conservative care like rest, medicine or physiotherapy, sometimes nerve block injections also, which will help them to recover in a much faster pace.
And I think we're very fortunate being in Aster. We have all the advanced latest technology, state-of-the-art equipment, whatever is necessary for performing these kind of spine surgeries safely. So we have the right expertise, we have the right experience, right technology, and the most important thing, we work as a skilled team. And it's the team effort that brings out the best, whatever is necessary for the patient to improve the patient outcomes.
Yes, so it's all about the holistic approach where we don't see only the scans of the patient and decide the surgery. We see the patient, we examine the patient, we look at the emotional aspects, we discuss the family issues, and then come to some final conclusion.
So the message is simple. Most spine problems can be managed with conservative treatment, and where conservative treatment fails and where surgery needs to be done, minimally invasive spinal techniques can definitely improve patients' outcomes, can be done safely, can be done precisely, and definitely have an advantage.
Yes, and delaying surgery due to fear or misinformation can sometimes do more harm than good for the patients.